Well, hello, everyone. Dr. Arabpour from the Lima Memorial Heart and Vascular Institute is here with us today to talk about the importance of addressing heart concerns as soon as possible with same-day heart appointments at Lima Memorial Health System. So thank you so much for joining us, Doctor.
Hi, Chris. Thank you for having me.
My pleasure. All right. Well, firstly, why is it critical to address concerns about the heart as soon as possible?
Well, patients may present with a variety of different symptoms. It may be something as simple as a skip heartbeats. It may be chest pain. Of course, we encourage people that when it is really a concerning issue, they don't wait and they go to the emergency room to be seen. But often, the symptoms may not be to the extent that would justify going to the ER, and that would be taking the back door in order to make their way into an office of a cardiologist and be seen. So symptoms of chest pain, lightheadedness, palpitations, or even sometimes atypical symptoms such as discomfort going down the arm, heaviness, jaw pain, and throat discomfort, which may be non-cardiac related at first. In some individuals may be a sign and symptoms of a heart problem. Okay. And in those cases, again, I advocate that patients should see a family physician or a cardiologist ultimately in order to get to the bottom of it. About 10 or 12 years ago, we as a nation decided to invest billions of dollars in electronic medical records. At first, it didn't seem like it was anything more than me, instead of writing in a paper, to start typing in patients' information in a computer. But then as time has gone by, this has allowed a greater access both for the patient as well as all the healthcare providers to your medical records. And if it doesn't translate into a faster access and better care for the patient, this is practically billions of dollars wasted. So let's say this past weekend, you're sitting at home and all of a sudden you start having some chest discomfort, nothing bad enough that warrants you going to the ER, or perhaps you even go to the ER, wait 6 hours, and then at the end they say, you're not having a heart attack, but we do recommend that you follow up. After all, ER is about making sure nothing bad is going on at that moment, and then delegate the further workup into your into future by your family physician or other healthcare providers. Now, come Monday morning, or in this case Tuesday perhaps, you pick up the phone, you call, and then you find that you can see a family physician in 2 or 3 days, and then subsequently you get an appointment for 2 or 3 weeks down the road to see a cardiologist. In my opinion, having a faster access, not only it is more convenient, it would save you a lot of those stress that otherwise unnecessarily you would experience, but also translates into a much better and safer care. So you could pick up the phone and call Lima Memorial and ask for the same day evaluation. You would be brought in on the same day. This is much beyond, far beyond what you want, perhaps your doctor would sit down and get engaged. It is involve a large amount of people that in a background, they gain access to all your medical records, things that you might have had 2 or 3 years before, in order to piece all these bits of information together, so that when we sit down and we'll talk to the patient, we don't end up duplicating the test. And at the same time, we have an easier time deciding what would be the appropriate care for the patient. So patient picks up the phone, calls the same day, and they would be often given an appointment on the same day. They will come in, and we have had availability and access to all medical records that have been perhaps pertinent to the problem at hand. All those, like detective, our staff would get together piece by piece, add to your folder, so that when you come and sit down in our office and you talk to me, I have access to all those records, and some of those that you may not even know they are relevant play a major role in me deciding what other test needs to be done for you. So I think this is better care, this is faster care, and perhaps more efficient and cheaper care. And I don't know of an individual who doesn't want to have that type of a care when it comes to at least their heart.
If patients are needing specific follow-up treatments and procedures after their appointment, well, how quickly are you able to get patients in for the care that they actually need?
There is no point in seeing a patient and ordering a test and say, see me in a month from now. So at the same time that we have decided that this same-day visit is essential, we also have worked in order to accommodate the testing in a more expedited fashion. So if I order an echocardiogram, a stress test, and perhaps some tests may do take a little bit longer, like, for example, 2 weeks of monitoring. That's the nature of it. Those testing can be often scheduled for the very immediate next day. And within a day or two of completion of those tests, you should be able to come back to the office and sit down and speak to someone like myself. And then we decide whether your workup is complete or perhaps if you need any additional testing done at that point.
Someone needs to address their heart concerns soon. How can they actually reach you?
They can call Lima Memorial, our office, 224-5915, and request the same-day office visit. This is true of those patients who are already established with us and they experience some problem. And obviously, we don't advocate that they sit 2-3 days before they come back and see me, as well as the new patients who may have had some symptoms or concerns that they would like to discuss with a cardiologist. Often, we ask them to perhaps allow us at least a couple of hours to that detective work to take place, and we can gather any relevant information they may have, so that when they come to us, we have a little easier time piecing the puzzle together and probably ordering the most effective and essential tests needed.
Well, don't go away because we have more when we return.